Hi, and welcome to this episode of Better Brainwave. And today we're going to be talking about and learning about global developmental delay and some of the various offshoots of global developmental delay. We'll learn about some of the networks that are probably involved inside the brain causing this situation. And then at the end of the learning component of the video, we'll talk to some patients and some parents that have gone through this and the effect that the treatment has had on them. So I'm glad you're here. Hopefully you're enjoying the YouTube channel. If you are, please subscribe and like the videos and tell your friends. Don't forget to ring the bell. If you ring the bell, you'll get notifications every time we put up a new video. Okay, let's enjoy. One of my favorite lessons because it encompasses a wide variety of the approaches that we use when treating a patient. Now, this particular patient happens to be a child, so a pediatric patient, but nonetheless, the approach could be the same for any patients that we tend to see. Now, the first thing that I want to review, and we have talked about this in the diploma program, but I'll review it now for everybody so that we're all on the same page, is that there are a variety of neural circuits. So we used to think that certain areas of the brain, the frontal cortex, the lateral prefrontal cortex, the parietal cortex, and all had sort of a variety of roles, and the Brodmann areas all had a variety of roles. And this is true, they do. But now we're realizing that they only contribute to those roles that we originally thought that they had, and that the vast majority of the processing that's done in the brain now is done by networks. So we have neural networks that are that have diverse functional roles, but they include some of the same aspects or some of the same properties, if you will, in the brain, locations in the brain of neurons that are shared between these neural networks. So, for instance, the salience network uses a part of the anterior cingulate cortex, as well as the negative effect and the positive effect networks. And you can see that the negative effect network involves areas of the anterior cingulate cortex, medial prefrontal cortex, insula, and amygdala. You will also see that down here, cognitive control, dorsal prefrontal cortex, and the parietal cortex and the dorsal parietal cortex are all involved. Attention, lateral prefrontal cortex, and precuneus areas of the thalamus are all involved in the attention network. So we get to see that variety of different functions or behaviors are underpinned by the neural activity in these functional networks. So basically the neural networks that we see, these are just 6 the neural networks here. There are some more, but I just use these as examples to show you that different areas of the brain have to come together to perform different functions and different behaviors, different responses. So this is sometimes one of the issues that we have, is that these neural network connections are interrupted, or they're happening too slowly. And in some cases, they're happening too fast or too much, creating confusion in these networks. So basically, the neural networks are all composed of groups, functional groups of neurons, which connect to each other through a variety of different connective pathways, and then they can be brought into activation when they're necessary, when different functions or different integration has to happen with the input that's coming into the brain or the output that's going out. Now, we also can refer to these networks as distributed circuits, and they're neither present at birth or are they invariant through life. So we have a distributed neural network that we call networks, and they connect together to do various things, but
the fact is that the development of the brain circuitry requires a coordination of extraordinarily complex set of neurodevelopmental events. And the structure and function of these circuits perpetually changes as we evolve through different phases of our personality development and through different phases of our life. And so basically there's a environmental component, a genetic component, and a built-in systematic use component. In other words, a certain level of use has to, or consolidation has to happen in these networks before they will establish. So we can have different cellular characteristics of neurons which are determined genetically. So some neurons will fire only under certain conditions. Other neurons will inhibit neurons. There'll be inhibitory neurons. Other neurons will have a modulatory effect. So they may not inhibit or excite, but they may change the way in which a neuron will respond under different circumstances. So we have diverse configurations and functional attributes within a finite set of genetically and environmentally constrained networks. And so, well, basically any combination or any developmental trajectory could, potentially come out of this. It seems that in the human development, we have a pretty predictable developmental timeline and a pretty predictable developmental rate, which we can measure and which we have measured, and which we develop milestones for which the development of these networks and the behaviors that these networks produce can be measured. So that gives us our developmental milestones. Now let's talk about the timeline of neurodevelopmental events. So we have conception, and during that sort of first 4 weeks, we have the neurulation component. We get neuroproliferation happening starting in about the 4th week, going through the 12th week. Now some patients won't even know, or some people wouldn't even know, some women wouldn't even know that they were pregnant during most of the neurulation and neural proliferation phases, which means it's important if you are planning on having a child that you do not do things that may endanger the normal neurulation process and the normal neurulation proliferation process, especially because you won't know that you're pregnant potentially while these processes are happening. So when you're attempting to have a child, or when you want to have a child, you need to then correct your lifestyle to avoid things that we know can potentially damage this process, like alcohol and nicotine, any kind of recreational drugs, and potentially some prescription drugs can also affect this developmental phase of the nervous system. So next we have the neuromigration phase, and this is the point at which the neurons that were produced in the proliferation phase will start to migrate away from the ventricular area, which are the areas immediately surrounding the ventricles in the brain, and start migrating more towards the cortex of the brain. And where they stop in that migration, we think is genetically pre-programmed. However, there are some studies that show it's environmentally induced by the glial cells that are surrounding and leading and guiding the neurons to their final targeted resting place, where they will form a functional network. Then there is synaptogenesis, where the synapses form between the different neurons. And then there is myelination that occurs. And this myelination seems to be relatively parallel to increase in synaptogenesis. Increase in myelination determines the maturity of the brain. So as we mature, the myelination increases, and so does the synaptogenesis, or the formation of synapses. Now, there is another process called apoptosis. Apoptosis is a pre-programmed cell death, so that neurons that are not being used properly or haven't connected properly, they will undergo a process of destruction and be removed. So this pre-programmed apoptosis is probably a good thing. Now, postnatally, so after we're born, we have an early postnatal period, and this represents a time of dramatic change in brain structure and function. The brain grows about 70% of its adult size in the first year of life, and it's about 80% of the adult size by the time you're 2 years old. So there's a huge growth in the brain size and the brain productivity during that period, first 2 years. And the increase in brain volume during that first year is also very great in the cerebellum, and followed by the subcortical areas, and then the cortex, which increases by volume by an impressive 88% in the very first year. Okay, so it's a very fast-growing area of the brain, and all areas are growing fast in that first 2 years. So it's a very important time in life. We get development of gray matter, which are the cellular components of the brain, and we get development of white matter, which are the axonal transmission wires or transmission segments of the brain. And we have myelination, synaptogenesis, pruning, synaptic modification, which are starting to establish the fundamental anatomical organization in those initial functioning circuits in the brain that were started in utero. Now, the brain myelination across development, we can see here that the, just get this here. So the yellowish areas here are representing the areas of myelination. This is the area of myelination at 2 weeks. You can see at 1 year, we have significant myelination starting to spread, especially through the sort of mid or what we would consider the primitive parts of the brain. And then as we age into an adult, we see that the myelination is spreading out in through the cortical areas. So myelination can be looked at as a way of maturation of the brain. Now, brain development, unfortunately, is susceptible to some adverse influences, as I've discussed, during the in utero period, in fetal development, but also in this sort of very important first 2 to 4 years of life. We have things that can happen to us, like exposures to toxins, to drugs. We can have nutritional deficiencies, infections, medical illnesses, and environmental stressors throughout our life. And so certain neurodevelopmental processes occur within a relatively narrow temporal window, or a window of time, where certain thresholds have to meet, or certain components have to come together, or that developmental process is either stalled or doesn't happen. And that can influence development of these networks that we're talking about. So, for instance, early separation from caregivers, abuse, neglect, social deprivation in infancy or early childhood can result in enduring behavioral and neurocognitive deficits throughout the life of the child. So it's important that we address these issues early in life and try to correct them if we can. Now, the development of executive function is a very important area of development at this time frame. So as children and adolescents mature, obviously they navigate increasingly complex social environments, and they try or will be given greater autonomy from their parents and caregivers, so that they need to learn how to function on their own. And so to be successful in these tasks, they need to learn and integrate a number of different cognitive and behavioral processes. And some of these processes seem to be subserved by different neural networks. Now, the higher processing, the higher order cognitive processes, which we collectively term executive function, include things like allocation of attention, working memory, and self-regulatory control. So by allocation of attention, we mean how much of my brain processing power do I apply to a certain thing I'm attending to? How much of my working memory do I use to solve a certain task? And how do I regulate my emotional outbursts or my emotional interaction with the world? So these are the sort of main components of the executive function. Now, working memory basically refers to our capacity to attend to something and update information. So, and that information needs or is usually currently relevant and available online for our conscious evaluation and manipulation. Depends to a large part, and not solely, but it depends to a large part on the prefrontal cortex, and specifically the dorsolateral prefrontal cortex. And working memory also can engage attentional processes that are based on the lateral and superior frontal parietal networks that include the superior frontal sulcus, ventrolateral prefrontal cortex, intraparietal sulcus, and the supramarginal gyrus. So we can see here that, again, this is a network, and this network is necessary for components of attention and components of working memory, and how we activate working memory, and how we bring memories together cognitively that we can use now to determine how to respond to a situation, and to also determine how much of our attention we're going to allow to be focused on one thing or another. And that is the whole concept of the executive function, or the ability to be the boss that determines how the workers are engaged and what jobs they do. Now we're going to talk about self-regulation now, because this is a fairly broad and important area. But basically, cognitive control of self-regulation involves many mental processes that are responsible for executing and guiding and monitoring the behaviors that are desired in a certain environment, while inhibiting other behaviors that may be inappropriate or disadvantageous in a certain environment. And so we need to understand, first of all, that in order to do this, you have to access the components of working memory. You have to understand the emotional input that's happening. And it's a very complex stew or soup of neural activities that have to happen. And so we have to do this by regulating our attention system and our conflict and error monitoring system. So we can't learn what the appropriate behaviors are if we're not understanding that some of the behaviors we're doing are inappropriate or are being disadvantageous to us. And this potentially is one of the areas where developmental delay can really affect a person's social development and psychological development, because they don't understand when they're making mistakes. So it's very difficult for them to learn, especially in complicated social situations. Okay, so we have to realize that there's a lot contributing to the broad concept of self-regulation. So we need to, that involves emotional control, it involves metacognition, it involves flexibility, the ability to be flexible in certain situations, inhibition of certain emotions or certain behaviors, or sustaining certain emotions or certain behaviors, initiation of action, initiation of behaviors, even initiation of action to respond to certain behaviors. You need to have planning and organization involved. So that self-regulation is a very complex soup of brain activity that has to occur, and you can understand how if we have certain of these networks not developing properly, then our self-regulation doesn't become normally controlled, and we start to have deviant behavior, and people start to notice. Now, so self-regulation, again, relies on broad cortical areas, as you can imagine. So we've got things like the supplementary motor area, the frontal eye fields, anterior cingulate cortex, as we've talked about before, dorsolateral prefrontal cortex, ventrolateral prefrontal cortex, lateral orbital frontal cortex, as well as the temporal and parietal regions, all of which have connections with the striatum and in the subcortex. And children and adults engage these frontal striatal circuits when performing tasks that require self-regulatory control. So the striatal circuits are down in the brainstem, including the substantia nigra, including the areas that control gating in the thalamus. So it's a very complex network that we're starting to talk about here. Okay, and that network involves the orbital frontal cortex, as we've said, the ventromedial prefrontal cortex, the ventral striatum, the thalamus, and gating in the substantia nigra and the amygdala, which is involved in the allowing us to process or understand fear or danger. And of course, this little guy here, the cerebellum, not so little, but we call it the little brain. And the cerebellum is going to be projecting into these areas also. Now, age-related activity in the frontal parietal and frontal striatal circuits occurs concurrently with improving working memory and cognitive control in a normal development situation. So the capacity to manage increasingly complex tasks, self-regulation, especially setting motivational or emotional conflicts, settling those, largely emerges in adolescence. Now, during this period, the gray matter thinning is seen in frontal parietal regions due to apoptosis happening. So we're removing neurons that aren't performing well or have significant use thresholds. But we can see that the conflicts that we're trying to resolve in adolescence do produce a variety of different behaviors, which are relatively consistent, even though there are many different types of behaviors that happen in adolescence. They're relatively consistent, and we recognize that these are associated with the teenage years, and at a time where there's emotional turbulence and finding oneself, being able to understand how to control emotions, understanding how to react to emotions you don't understand, or to other people's emotions that you don't understand. Very complicated time in our life, and is a time where we do have confrontations, should I say, with our children occasionally. Okay, so basically what happens with the synaptic connections during this time is a remodeling, and there is a greater connection established between network nodes which allow increasing engagements and more efficient functioning of these circuits. And that's how we're allowed to deal with the more challenging situations that rely on executive function. Now, you can understand now if there's a developmental delay as a child, and that delay continues or causes other delays in other networks. You can see at this really important developmental time of adolescence, it can become a major problem. Now let's talk a little bit about mental illness now, because mental illnesses that emerge in childhood and adolescence are being increasingly conceptualized as disorders within the neural circuits that support the various domains of cognitive functioning. And therefore, a thorough understanding of normal development of the brain is critical when we start to identify causes and allow us to improve treatments of psychiatric disorders in children and adolescents, like obsessive compulsive disorder, attention deficit hyperactivity disorder, Tourette syndrome. We're seeing also increase in pediatric depression and pediatric anxiety disorders. So all of the normal developmental situations in these kids need to be evaluated and assessed. So we can see that there are basically top-down guidance of attention, and there's inhibition of inappropriate actions, and then there's regulatory areas of the brain that regulate emotion, and these are all commingled to the brainstem in a variety of different areas, and also use deep nuclei of the brain, like the amygdala, hypothalamus, basal ganglia, to coordinate these actions appropriately. So it's basically a use of the complete central nervous system. And we can even extend that to the environmental sensors that are allowing these networks to function properly. So it is, in fact, the complete nervous system that is being manifest in these behaviors that we're seeing. Okay, so now let's talk about this global developmental delay thing that happens. If we have a global developmental delay, and now what's happening is that they're dividing the global delay into various more succinct components. But we're going to go through this developmental delay because I think this is a very common symptom or a very common presentation that you're going to see in your practices once you start treating neurological disorders and using neuroplasticity. So basically, let's talk about what the term actually means. So developmental delay is used when a young child is slower to develop, either physically, emotionally, socially, or within communications skills than expected when compared with other children of that age. Now, usually it is also a necessary component of a developmental delay syndrome that there is no anatomical or biological cause that can be identified that's causing this delay. So it seems to be just a delay that has been produced by either a delay or a slowing of these network developments that we're talking about. So it can show up in a variety of ways. So it can show up in how the child moves. It can show up in how the child communicates, how the child thinks, or how the child learns, or how the child behaves or interacts with others. Okay, so it's and when more than one of these things are involved, we use the term global delay. So this is where I was talking about they're trying to separate or divide the basket of global developmental delay into different sections. So, and that's what this little chart is showing us here. So the little chart is saying that if you have autism, so autism can be a component or a situation arising from global developmental delay. You can have speech and language disorders. You can have hypotonia, or low muscle tone. Epilepsy is often associated with global developmental delay. Developmental coordination disorder, which is one of those separating components where we look mostly at how the child moves. Learning difficulties, hypermobility, so you can get both hypotonia and hypermobility. ADHD, genetic chromosomal disorders, sensory and auditory processing disorders, and usually you will have a variety of these or many of these at the same time presenting in these kids. So we have a lot of comorbidities associated with global developmental delay. Now, we're going to focus a little bit on the developmental coordination disorder because that is the focus or the diagnosis of this child in this case that we're going to be presenting soon. But you can see that the developmental coordination disorder is also associated with a lot of comorbidities and very similar to the comorbidities of global developmental delay. So it's sometimes tough to differentiate these kids. Now, developmental coordination disorder was first sort of brought to the attention or identified or discovered by McLeod in about 2014, around there. So it's been with us for about 7-8 years now. And basically the prevalent neurodevelopmental delay is in school-age children. Usually there's an early onset, and it persists into adulthood if not treated. And although it is a heterogeneous disorder, so there's different phenotypes that can happen, it is characterized by a persistent motor impairment that negatively affects daily living activities or academic achievement. And it can't better be explained by an intellectual disability or underlying neurological condition. So that's one of the sort of fallbacks in these diagnoses, is that they can't be easily explained by other medical conditions or other medical problems. So let's go through this developmental coordination disorder. So again, sensory integration disorders, auditory processing disorders. Now here's where depression starts to come in. Depression, ADHD, occupational defiance disorder, specific learning difficulties, autistic spectrum again is in there, anxiety, Tourette's, OCD, and some of these children are often gifted in certain areas. So although they have a slowing or disability in one area or some areas, they may have an area in which they are gifted.
So I hope you enjoyed the little learning component of what we think is involved in the brain in developmental delay and the various coordination delays and other things that we talked about. And now we're going to go in and talk to some patients that have experienced this and perhaps get some feedback of how the treatment has helped them and what they feel about how the treatment has changed their life. Okay, thank you.
They're rolling.
My name's Shana, and my daughter's name is Sienna, and she's 13 years old. Sienna was initially diagnosed with a developmental delay when she was 3.5. She was slow to develop in all her milestones, and we specifically came to see Dr. Beck so that we could, primarily I wanted to work on her reading, was my initial reason for coming. What we've found so far, and we've only been doing this for about 12 weeks, is it 12 weeks? Although we have had no academic improvement yet, we have seen a lot of big changes in Sienna, mostly in her engagement with other people, how she interacts with other people. She uses more 3-syllable words. She is more articulate. She's less withdrawn, less in herself, more outgoing, more confident, and she's actually much happier. And we didn't actually realise the full extent of how flat she was until we saw the improvement and saw her as a happy, as the happy child that we'd never seen in her before. So,
What would you say of the actual treatment itself?
It's very different from what we've done in the past, where our other approaches have been more, let's say, academic. Things like walking backwards, standing on one leg, listening to Mozart, were in some ways less like work for her. So she was more inclined to feel positive about doing them after having done a lot of remedial academic work before. But listening to Mozart, she's actually starting to gain an appreciation of classical music, which she'd never had. And yeah, there are still times where you have to, let's say, encourage her to do things, if she, you know, and maybe pair it with a reward or something to get her to do it.
Excellent. Now, so would you would you recommend this to other people?
I think it's definitely worth a try. Absolutely.
Excellent. Thank you.
So, yes, we started off once a week, and then when we could make it 3 times a week, we started introducing that, and we've followed that through till today. We've had great successes. In the past, Neil would have successes, say, every 6 weeks to a month, 6 weeks to 2 months would be something really good. We would notice a change. We never stopped working with programs and stimulation and nutrition and that, and he's worked so hard at trying to do his best in everything. And yes, so he's much more relaxed now, and since coming here we have found now that every session, we come 3 times a week, and every session we're noting about 3 new changes in him. Some are subtle, but some are quite profound, and yeah, so it's all very, very good. He started off with the reading. He could only focus on 4 words to remember at a time. He's up to 12, 14 words. We can read a whole sentence and he'll follow that through. When he's tired, he often doesn't do his best, so he does work at making sure he gets his sleep, because he needs to work well as well. And yes, so we're very pleased with the progress he's been making, and amazing changes.
Excellent. So, Neil, what do you say to your mom?
Oh, thank you, mate. Yeah, like, you know, I found with my left hand it's getting a lot stronger. I can actually hold bottles without grabbing the bottle before it drops. You know, my face feels more relaxed. I'm finding people come out and talking to me, especially the girls. Yeah, like, you know, I find it easy to talk to somebody I've never met before. I learned to, like, standing up a lot straighter, sleeping better, you know. Yeah, you know, nothing phases me when I'm asleep now. I'm working a lot better. I just recently got a new task to do where you have to use your brain a fair bit. That's full on in the deep end there, but I like that sort of challenges. And I've done a camera course today. It was a situation, was a class situation. At first that was a bit daunting because old memories came back, but they faded away pretty soon, and I retained everything. All about, you know, what what we learned in the course, which was not able to do in the past, because I would have come out and thought, what was all that all about, you know. I can read better now. I think my speech is a bit better now. You know, I'm talking properly, you know, all little words all matching together instead of just, you know, jotting and, you know, bits and pieces missing out. Yeah, like, you know, I think a lot of people find a difference because they sort of step back, you know, something's different about him. But yeah, they are. It's pretty good. Bit of pain, but you know, no gain. But yeah, you know, my water intake's gone down. Light sensitivity's better. I'm wearing my glasses all that much. Yeah, like, you know, I feel a lot stronger. Last night, my left hand makes a whole heap of resin chairs up, which I couldn't do before. I would slip and pick them up like, you know, like a feather weight. It's like, this is different, you know. Yeah, so, you know, the strength's there, you know, my energy's there. Yeah, like, you know, I'm feeling, you know, very good, you know.
Excellent. So, all in all,
I'm pretty happy with the progress. Like you say, every week there's 3 things happening instead of a month. And a little window opens and then it'll shut and we'll go back to the normal. And then we, you know, waiting for the next window open. But this is like every week it's 3 things happening and they're actually holding and not disappearing. Yeah.
excellent. Well, thank you very much for your comments. Go.
Hi, I'm Nicole.
Hi, I'm Courtney.
Courtney's my 13-year-old daughter who has dyspraxia and anger issues, social problems. We've been seeing Dr. Beck for 6 months or probably 8 months now, and just the improvement is just amazing. It's just come along leaps and bounds. Still have our little problems, issues, but yeah, she just improved so much. She knows now how to just diffuse situations and socially, and just, yeah, it's just getting so much better. I'm so proud of her.
What do you think, Courtney?
It's good.
You're enjoying it?
Yes.
Has it been fun?
Yes.
You didn't mind the work too much?
No.
You noticed in yourself a change?
Yes.
Very good. And so now at school, when you have a confrontation, what do you do? When someone tries to get the best of you, what do you do?
Just ignore them and walk away.
Excellent. Very good.
It's funny, isn't it? And yeah, just little situations like youth groups and things like that she would never have gone to, but now she enjoys them, loves them, and just
Very good.
socialising a lot more, and yeah.
Well, thank you very much for sharing this with us.
Thank you for everything you've done.
Oh, you're welcome.
Thank you.
Bye-bye.
Bye.
Go. We're running.
So this is Sophie, she's 7, and I'm her mum Mark. We've just finished the 12 weeks of the 3 times a week therapy. When we first arrived, she had a terrible memory, couldn't remember things. She, with terrible reading, would read a word at the beginning of the book, couldn't remember it by the second page. Since then, she was probably at pre-primary level reading, she's now at grade 2. She has confidence, she is just so happy, and I think that's probably the best thing that I think has come out of this. She's the practical joker now, whereas before she didn't have the vocabulary or the ability to say those sorts of things. So for us it's been excellent. Big investment in time for us. I have a full-time business, but certainly worth every dollar and time, because she's just a different kid and I'm just so pleased for her.
Do you have anything to say, young lady?
No.
Are you happy?
Yeah.
Yes. Did you have fun coming?
Yeah.
She especially liked being tickled by Russell. But no, it's been a it's the 12 weeks to me seemed like a big journey, but it really, once you get into it, and I think the main thing was practicing or doing the therapy at home as well. But she, at the 6-week mark, certainly when she came back for that test, had a revigor of doing the exercises. That was probably a good time to do it because we were sort of both a bit, but it just, the results have been astounding.
Very good. Thank you. One last time to be a star. Gonna wave bye to everyone?
No.
Say bye-bye.